The time has now come for the keynote address. This invitation is for the conference chair of the annual scientific session, Professor Terence Madhujit, to introduce the keynote speaker, Dr. Angela de Silva, to the audience.
Good morning, ladies and gentlemen, those who are physically present and also those who are joining online. Thank you very much, Honorable State Minister Dr. Arambepala, for thought-provoking introduction to the proceedings of today and tomorrow. After her inspirational introduction, I feel privileged and honored to introduce a great personality who has basically devoted her life to nutrition. More importantly, she's one of our colleagues, she's one of our mentors, and she has been serving as one of the past presidents of NSSL, Nutrition Society of Sri Lanka, some times back. She has experience of more than 20 years. She is in fact none other than Dr. Angela de Silva, the Regional Advisor, Nutrition and Health for Development, attached to the World Health Organization's Regional Office for Southeast Asia. Dr. Angela served as a medical officer in the Ministry of Health, Sri Lanka, and then worked in the capacity of academic as a senior lecturer attached to the Faculty of Medicine, University of Colombo. During her tenure in Sri Lanka, she worked as a consultant to many international agencies prior to taking up her post at World Health Organization. At WHO, her portfolio includes advocating nutrition and health issues and providing technical support to the 11 countries of WHO Southeast Asian region and for advancing nutrition policies, strategies, and plans and their implementation to promote equitable nutrition and development. Her interests and work include providing support expertise to develop, coordinate, and strengthen governance capacity of countries to deliver of life course nutrition interventions through health systems, other settings, and their monitoring and evaluation. Dr. Angela de Silva served as a committee member of Nutrition Society for many, many years, and also she served as the president of Nutrition Society of Sri Lanka during the year 2013 and 2014. So without much ado, let me invite Dr. Angela de Silva, who is joining online. Over to you, Dr. Angela.
Good morning. It's a pleasure to be with you all and connect with all friends and colleagues. President and the Council of the Nutrition Society of Sri Lanka, I thank you for inviting me to deliver this keynote address today. As a long-term member and a past president of the NSSL, it's a great honor to join you all and contribute to the scientific sessions of 2021. Before we get on to discussing multi-sectoral approaches for nutrition programs, it's useful to remind ourselves of the magnitude of the problem we face. We know that with population growth, urbanization, changing food habits, economic issues, and the increasing cost of food, it has become more and more of a struggle to ensure healthy and adequate diet for people. And the COVID-19 pandemic has not made matters better. Ensuring nutrition security is one of the greatest development challenges that's faced because of the COVID pandemic. Now, we are familiar with the conceptual framework for malnutrition that shows how the drivers of malnutrition are interrelated and the various levels at which they influence nutrition status. We know that the immediate causes are related to nutrient intake and health, and then the underlying causes, which are due to household matters, our health sector, and community. And all these are impacted by the basic drivers, which are the agriculture, trade policies, economic status, what we refer to as nutrition-sensitive aspects. So it's very clear that nutrition has multisectoral dimensions, which obviously need multisectoral solutions. If we take the nutrition status in Sri Lanka over the last 20 years or so, we can see that there's been some progress, but nobody will dispute if I say that undernutrition, especially in children, has been stagnant. And overweight and obesity has increased across all ages. The national multisectoral response to this has been inadequate. Recent in-depth analysis on undernutrition utilizing DHS data was done by WHO Sri Lanka, and it shows very clearly that while addressing health system and other related factors such as birth weight and adolescent health are essential in order to improve stunting and wasting, addressing poverty through social protection, female education, improved food security are also vital. This is not new information, but it's also data for further advocacy. So what is the reality on ground? Are we embracing and implementing multisectoral interventions on nutrition at a national level? Of course, there are programs addressing nutritional aspects across many ministries, and I'm aware of many ongoing projects in various parts of the country. But at a national level, I don't think that Sri Lanka is implementing a sustainable, coordinated, multisectoral nutrition program. At least it's not enough to impact national data. If we take the National Nutrition Action Plan, the multisectoral action plan for Sri Lanka that was developed in 2013, it was developed with a lot of effort, but I don't think it has achieved the expected impact. The coordinating platform functions are not clearly mandated. Even the monitoring was inadequate, and there's little implementation of some of the actions. The platform itself was also not sustained. Now, there are some reviews of the National Multisectoral Action Plan implementation, few of them, which offer some insights. But overall, it shows a rather disappointing picture, which identifies aspects such as poor governance, lack of coordination, budget issues, insufficient capacity in terms of HR, lack of clarity about each of the sector-specific roles, and basically who does what was not clear. As for any of the actions, it's very easy to sit and say, okay, this didn't work or this worked, and it's very easy to identify defects and deficiencies, but what is the solution? We really need to think of urgent solutions, considering that a new MSNAP has been developed, and advocacy and planning to operationalize this in a systematic manner is absolutely essential. Now, if you look at the global literature, it's full of information about the need for multisectoral actions, examples of plans and their process of development, but little information is available on the how-to. This is a problem with many of our programs. So countries have tried and tested to see the best way possible to set about ensuring a national level response. For a multisectoral nutrition program to succeed, concurrent coordinated actions are necessary across multiple sectors and levels of government. Of course, this is easier said than done, and there is no one recommended method. Each country has to identify what is best for them, and what I can share are some key principles and strategies that have worked or look like working elsewhere. One main point that needs to be addressed is, of course, governance. Is there policy coherence between agriculture, health and nutrition and other related policies? Do our agricultural policies or social protection policies support the promotion of a diverse, healthy diet? Have we examined these? I'm not sure. We talk about nutrition-sensitive agriculture, nutrition-sensitive social protection, but if the specifics of these are not included in other sector policies and strategies, it is unlikely to work. The other important point is a robust multisectoral platform for coordination with strong leadership. Without this platform, without a strong leadership, not just at the top, but at different levels, multisectoral actions are not going to work. The implementation of a multisectoral approach presents a lot of challenges and needs a lot of coordinating and understanding between sectors. I'm sure all of us have experience of sectoral focal points who come for meetings, who are at a low level in their ministries, who change from meeting to meeting, and there's no continuity and they're unable to influence their ministry actions. That is why stakeholders often promote the need for a high-level anchorage of multisectoral nutrition platforms, such as the Prime Minister's Office. But while this is a really great idea, we also need to remember that there are many competing interests at the highest levels of governance, that probably have priority over nutrition. In the health itself, for example, there are multi-sectoral action plans for non-communicable diseases and other aspects. So if you think about the number of things that have priority, it's difficult to think that nutrition will have a bigger priority than other subjects. So many countries that have created these high-level institutions for multi-sectoral nutrition coordination found that they were not sustainable. So it's always better to choose an existing coordination platform than to form a new one. But definitely it has to be at high level enough to encourage commitment from all sectors. The strong leadership is also essential, and the office has to be sustained through political changes. With this, for example, in Bangladesh, we see this kind of committee with the Bangladesh National Nutrition Council, which is a high-level committee, and that's able to enforce commitment, attendance from high-level ministerial focal persons and monitor progress. In Indonesia, the leadership is usually through the National Planning Commission, which is also at a very high level, and where there's a lot of highly technical qualified staff. And these officials attend the relevant policy discussions in all ministries. Other important aspects are definitely it's important to have a technical committee at this high level and also to have some effective working groups. For example, in Ethiopia, what happens is the sectoral working group is formed from some ministries with representation from different directorates within that ministry. And that particular contribution is then taken to the main platform. So strong structures and mechanisms are needed not only at high national level, but also at subnational level. Now we have a very good example in Sri Lanka, which is the District Development Committee. This is a really good structure to anchor multi-sectoral nutrition programs, and this has been happening to some extent. But some of the, one of the assessments that was done on multi-sectoral nutrition action plan implementation, it shows that some of the districts, this was working well, whereas in others, it wasn't. I want to read out what some stakeholders had to say about the implementation of the multi-sectoral nutrition action plan in districts during a qualitative assessment. Multi-sectoral action plans on nutrition are a failure in some districts. Poor coordination and the lack of commitments are problems identified by different stakeholders. The funds were allocated to the divisional secretariats to run various nutrition-sensitive interventions, such as prevention of alcohol and narcotics, animal husbandry, and home gardening. However, most of the funds were utilized to conduct nutrition awareness sessions, which are already present in the health service package provided by the Ministry of Health. And such duplications are a wastage of resources. I'm sure we are all aware of these issues. And that brings us to another point. Having a multi-sectoral platform is not enough. Effective coordination requires that everyone has to understand and agree about their roles in contributing to the final outcome. Everyone needs to understand that what has to be coordinated, by whom, how, and for what purpose. The activities that are carried out by each sector has to be defined, and it has to be specific to their sector and mandate, and this would be the best use of resources. But this doesn't always happen. At least it didn't happen in the past, but we need to ensure that it happens in the future. Accountability is another important aspect to consider. Accountability for both the process of implementation of the plan and the nutrition outcomes is really, really important. So investing in multi-sectoral surveillance systems that monitor and evaluate both the process indicators as well as the outcome indicators is essential. And these indicators need to be based on a common results framework, and they have to be tracked, and they have to be the responsibility of a high-level multi-sectoral platform. I don't think with the current technology in place, it will be difficult to set up such a process. And also one other important aspect that we need to remember is the data that is generated should be analyzed, shared widely, and used, which is unfortunately not often done, not just in Sri Lanka, but everywhere else as well. Now, one successful example of accountability comes from India, where the Poshan Abhiyan, which is the new National Nutrition Mission, is monitored very closely by institute which is called the NITI Aayog, which is actually the Prime Minister's Planning Commission. The National Council on India's Nutrition Challenges is under the chairmanship of the Vice Chairman of this NITI Aayog. And this is like a premier policy think tank for the government of India. And it acts as a platform for cooperation between sectors, not just for nutrition, but for other aspects as well. This model works very well for India, but for Sri Lanka, we need to find out what the best, most feasible option for us is. One of the other very important aspects is the common understanding, communication, and knowledge. As nutrition and health professionals, we often make the error of assuming that others know what should be done. Often other sectors don't quite know what their role should be in supporting nutrition. And basically, it's not just undernutrition, but all forms of malnutrition. And this causes confusion, waste of time and resources. And to achieve this, again, strong leadership is very, very important. And this brings us to another interrelated area, which is the human and institutional capacity. Now, capacity development is not just the training of personnel, but also strengthening the support structures. Now, because of nutrition being a multi-sectoral subject, it requires individual, institutional, and system level capacities across all sectors to operationalize the interventions. We often see capacity constraints at different levels in the overall coordination, management and designation, management of the designated anchorage platform, in the technical teams, and because very often there's no dedicated implementation team to support the subnational efforts. Adequate nutrition-related knowledge, competencies to plan, implement, and monitor both nutrition-specific and sensitive interventions are really, really important. And guidelines and TORs are really necessary for the committees. And to achieve all this, maybe a capacity gap assessment is a really important assessment that could be done. Now, for example, one innovative idea taken up by my colleagues in NCD at CRO is the development of an online course for the use of other sectors. Now, it's an NCD course which is online, and it tells people what NCD is about and so on. With all this, there's no dedicated budget allocation. Sorry, with all this, if there's no dedicated budget allocation, actions cannot be implemented and are not sustainable. Development of a line-by-line budget and tracking system is really, really important. And a budget line should be the responsibility of the relevant sector and not actually the lead ministry of, for example, the health ministry in the case of Sri Lanka. Now, these are some of the few aspects which need attention if we want to have a robust multi-sectoral plan that is actually implemented well. As I said earlier, it's not the multi-sectoral actions have not been successful. There are some very good, remarkable achievements in Sri Lanka. And there are lots of multi-sectoral projects happening in various parts of the country, but a concerted national level response is missing. The country needs to decide whether it's going ahead with such a response or taking item by item approach, such as, like, for example, some of the food environment improvement interventions that were done, like the regulatory work with food labeling, which also multi-sectoral, but they were taken as one aspect, one section or one part of the work towards the food environment. Now, the theme of this session, Together We Build a Healthy Nation with Better Nutrition, is an ambitious one. It's a clear call for unity and coordination in addressing nutrition. And I have taken this as an opportunity to talk about the multi-sectoral nutrition, multi-sectoral action plan, and the need for the implementation of it, and the aspects that need to be improved if you are going to implement and operationalize and have a successful plan that contributes to positive nutrition outcomes. Now, your conference program also reflects this with a lot of cross-cutting elements of health, agriculture, biodiversity, and other relevant areas. Implementing a comprehensive, sustainable, national level, successful multi-sectoral intervention is not easy, and it may have to be done in small steps. It certainly will need long-term vision and actions, And I hope that the Nutrition Society plays a major role in this effort. I will end my talk with a quote that I heard during last week's launch of the Status of Food Security in Asia report in Bangkok, and this was made by one of my colleagues at FAO. And he said, it's not enough to produce food, it should be nutritious food. It's not enough to produce nutritious food, it must be affordable. It's not enough for nutritious food to be affordable, there must be strong education and health systems to provide counseling and messaging to enable people to make informed decisions about what food to eat. It's not enough to know what foods are nutritious and to be able to actually purchase nutritious food. There must be well-functioning water and sanitation systems so that these nutrients are properly utilized by the body. The Nutrition Society has always admirably embodied and embraced this philosophy in its agenda, the multisectoral philosophy in its agenda, as well as in its diverse membership. I wish the Nutrition Society and the scientific sessions of 2021 all success. Thank you.
Thank you, Madam, for that keynote address of immense value.